at this time, I'd like to introduce Dr. Kithsiri Edirisinghe. He's a Deputy Chairman, Director Academics, Strategy and International Affairs, International Institute of Health Sciences. He's also the Managing Director of Green Healthcare Private Limited. Dr. Kithsiri Edirisinghe is a consultant medical administrator who has over 20 years' experience in the field of medical administration. He has administered many hospitals in the government sector, from peripheral units to a teaching hospital. He pioneered the building of a chain of hospitals in the private health sector of Sri Lanka, and has over 5 years' experience in administrating healthcare training institutes. He was the former Deputy Director of the Teaching Hospital Ragama and the former Chief Executive Officer of Hemas Hospital Private Limited. He is currently the project consultant for the upcoming University Hospital of Kotalawala Defence University at Merahara, Sri Lanka. He is also currently involved in a 300-bedded multi-speciality hospital with subspecialties of orthopedics, oncology, and renal conditions. Apart from his qualifications in medicine and healthcare administration, he is also an Australian certified master trainer. Dr. Kithsiri Edirisinghe, please come to the stage.
Okay, thanks. I think we are short of time, so I started. I think I should time my speech. So timer is on. Okay. My topic is on contemporary legal and ethical challenges for a nursing administrator. I'm a bit nervous to talk now because there are many nursing professionals in front of me as a medical doctor. With my experience of well over 25 years in the hospitals and healthcare sector, I thought to add some things, learnings that we have learned, put into practice, as well as modern day, what are the challenges that we have in the ethical environment. If you look at, there are a lot of expectations from nurses especially, and the doctors. The people think that the doctors and the nurses can put scrambled eggs back in the shell. So they think that we can do wonders. They respect us a lot. There's a reason for that. This is a difficult the service that we do. There's enormous amount of risk. There's enormous amount of effort that needed to get these people back. So therefore, it's not it's a public secret that everyone expects more from us rather than anybody else. With that thing in mind, let's look at a health cycle in a different way. As you know, you have the human body. Human body is the greatest ever created system, and which has a nicely balanced systems inside. There's input, output, and it balances. Sometimes this internal environment can get external forces which change the internal structure, and then we call them sick or ill. So once they are ill, it could be due to very many reasons, like chemical, physical, psychological, or biological reasons, which will push them to sickness. So then they come to us, sick people. Then we do healthcare interventions. We treat them. Those are called healthcare interventions. How do we treat them? We do physically, we do surgical interventions, we give drugs, chemical interventions, psychologically we support them, we do behavioral adaptations. All these are treatments or healthcare interventions. So let's look at the interventions. Now, interventions are extremely difficult to do, but still we have to do. We are the only professionals that we can support with the interventions. Now, these interventions are seriously difficult. It can change. There are many variations. For example, take a person who's going for a appendicectomy, present with appendicitis. The treatment may be surgical, and then the person walks into the theater. A lot of things depends on the life of this person. It depends on the hands or the skill or the mode of the surgeon and the nurses. Not only the skill, but at that particular, but how are we? Are we tired? All that would be loads of changes. Even if you look at the patient, patients could react differently to the same drug in different intervals. A person who's given paracetamol could be allergic in 2 hours, this next dose, So that can happen. There's a variation. Similarly, if you look at the infrastructure, the AC might not work in the theater, and then the equipment might not work, the monitor might not work. These things could change. And then, of course, the drugs and the consumables that we use. There could be variations in that. The quality may not be good. And then finally, the methods that they use. So the policies, protocols, intervention methodology could change. It could differ in different circumstances. So if you really look at these interventions are highly risky. We can't predict a person that this appendicectomy, let's say appendicectomy as an intervention, we could do 100%, the way we want. So they are highly unpredictable, and there's a lot of risk involved, and probability of having risk is enormous. And there's no black and white in this. There's a lot of gray areas in our interventions. So more you have gray areas, more you're going to have conflicts, issues, and of course the medical mishaps. Now they say moving into hospital and getting back, the risk, if you analyze, versus going to the moon and coming back. What do you think? Which has the more risk? Going to moon and coming back, that's it, one way, and come back. But going to hospitals, you don't know where we will end up. So if you really analyze, there are models to analyze healthcare risk today. And when you analyze these issues, and I think it's 100 times the risk going to the hospital like coming out. So as you know, so therefore there's many risks in our interventions, the treatment that we do. So how can we control that? These gray areas. One of the things that what we have built over centuries is ethics. Ethics should cover a lot of gray areas. For example, can you ask a person to give a painful injection? Can you ask a patient to give painless injection? Where will you stand at? As nurses, we have done this 1,000 times. There's no way we can give painless injection. Probably painless injections. You smile at the patient and then make it painless. So those are gray areas. You can't say this is black, this is white. And then, of course, we have laws and regulatory standards which protect the patient as well as you controlling this environment. People can't just walk out and start a hospital. You have to have regulatory clearance and also professional standards. We have nursing boards, medical boards controlling the healthcare provision that we do. Merely having a degree or a diploma will not allow people to practice medicine or nursing. They have to have a license to practice. They have registration. Parallelly, each procedure or the intervention that we do is covered by clinical protocols, clinical policies, and we have to abide by that. And finally, organizational standards and policies and protocols. Each organization, each hospital, each clinic has their own protocols of doing things, these interventions. So these will somewhat control the unpredictability of healthcare interventions. So let's look at the ethics. So I will concentrate more on ethics. And ethics has basically, as you know, the morally, the right thing that we have to do. And there are many definitions which I'm not going to get into. And then one of the key principles in ethics is the autonomy. We'll go to that in a while. And then we have the beneficence, doing right things, doing good for the patient, and then non-beneficence, not doing any wrong to the patient, and then, of course, the justice. What is the best choice that you have to do at that particular time? I'm concentrating more on ethics in this forum because it's a very, I think, 7 minutes. I'm looking at the counter timing. If you look at autonomy, autonomy is the human should have the right to choose. The patient has a choice. It's a difficult entity, I know. It's difficult, but we have to give them the choice. The choice, this is validated by many about 5 areas: confidentiality, privacy, veracity, fidelity, and the consent. Let's look at confidentiality and the challenges. The challenges imposed by today's world, as you know, we have dynamic environment around us. Every day the technology changes. Every day more and more patients are coming in, loads, and we have to work hard a lot than normally used to. And our skill levels, sometimes we have to go out of our borders to work to support these patients. So the privacy is the thing. Basically, in simple language, is that we will not intrude to patients' so-called private areas or the patient's areas that patient doesn't want to for us to go into. And once confidentially, basically, once you get those information, you make sure that you won't divulge those information to anybody else. So that's in basic language. So let's look at the technological development today. We have digital health, telemedicine, transfer any message, do a lot of things in peripheral areas, and hospital information systems. You get computers and the systems coming up with you, e-health, social media everywhere. In a second, you get to know where you are and what are the things that you do. The wearables. Wearables are the devices. You will hear more in latter stage of the day. Wearables are the devices that we use to monitor patients, and then nursing informatics, a big area developing in years to come. All these things will definitely open a different perspective in terms of the confidentiality and privacy. So what can we do now? The software developers will have their own security systems to avoid these things being transferred to anybody else. So as a future nursing officers, who you will have to undergo these technological changes will come to your ward. So what will you do? How to protect this data? How to protect the patient's confidentiality and privacy? Those are the challenges that you have to think about in few years to come. Let's look at the veracity and fidelity, other cornerstones of ethics. Veracity is being truthful for the patient, to the patient, and fidelity is working within your boundaries. When we were small, in the sense that our postgraduate days, that was about 12 years ago, 12, 13 years ago, we were taught a thing called health economics. In health economics, healthcare is looked as an area which the information is asymmetrical. Information is asymmetrical. Information is not freely available to the patients. Is it true now? No. Nowadays, it's just go to Google. They know everything. They'll ask thousands of questions from you. Every patient is asking, because everyone has a mobile, everyone has the access to Google. So can you, don't you have to know more about what you are doing now? Don't you have to upgrade yourself? If you're going for intervention, don't you have to just go to Google and see what's happening? Are we doing the right thing? Because the patient might ask. So these are the area challenges that we will get in future. And so as next step is, they will watch you, the patients, each step that you take, patients and the bystanders. Then it will end up in litigation, because our system doesn't have money. Our public sector or the private sector doesn't have money for litigation work. When they put cases against you, we don't have money. We hardly have money. So therefore, we have to really look at what we are doing. We have to be very careful what we are doing. We should know what we are doing. So fidelity, working within the scope of area that you are bound to do, trained to do. Can you do that now? Can you be a renal nurse who will not move into the surgical ward because there's nurses shortage? Doctors are there, maybe availability of doctors will be difficult to find the doctors sometimes, most of the time, and resource constraints. You don't have the necessary resources to manage, and every time the patient condition could change, and then more and more regulations coming up, more laws coming up. There's laws coming to protect patients. So therefore, Finally, you will get squeezed into this shell where you will not do anything because you don't move your hand because somebody might sue you. Something might happen. Are you going to do that? So the fidelity will challenge working within your scope of work. You will have to walk out the boundaries. That's the challenge then years to come. I know it's roughly about, we are short of about 30,000 nurses at the moment to run the whole sector in the government sector. Private sector, we have nurses, but we'll have to upgrade them to a different standards. All these problems are there. So these things will be challenged. Then finally, the consent. As we all know, consent has to be taken, patient's choice, whether he is willing to undergo this intervention or not. So the four founding things like the competence of the patient, competence of the staff, disclosure of all the necessary information to the patient, and then patient voluntarily undergo your intervention. Now let's look at the competence. Now in Sri Lanka, for patient has to be mentally competent, has to be over 18 years. That's the basic line of giving consent. Otherwise, the guardian or the parent have to come in. Attitude towards vaccination. One of the challenges the world is facing today. There are a lot of this anti-vaccination campaign. Thank God we don't have it. Our expanded immunization program is doing wonderfully well. You know, because of this anti-vaccination program, not because of that, but generally about 1.5 million children die every year due to lack of vaccinations. Maybe accessibility, maybe we couldn't cover them, all that. In that, and we have this anti-vaccination campaign happening in the West. Now, there was a measles epidemic happened in United States because they didn't want to get vaccinated. They're against it. Their choice, they haven't given the consent. They say, no, we don't want. So then another whooping cough epidemic came up after 70 years in USA. So what is the strategy? If it happens here, what we are going to do? I think we'll have to, the only way we can support them looking at evidence-based practice. When we talk to patients, we should know what we are about all of this. We have to tell them the pros and cons of everything what is happening. So therefore, education is one of the key. Education, keep educating yourself, participating for forums like this, and go to Google. Google has been a best friend, all of us, as professionals. I mean, some time ago, I had to sit into a project manager putting up a hospital. I have never done hospitals. Ultimately, up to now, I have done about 6 hospitals, and I advise the architects and the engineers what to do. How I'm doing it? My best friend is Google. You go to Google, you study, then you talk to your professionals. Similarly, it's high time that we upgrade ourselves. Make your friend as a Google. Then comes the choice, consent of the children. Now, there's a concept happening called Gillick competence. This is a case put against the parents by some of the children that they have to have. They should have some of the interventions done by themselves. For example, now this is the whole base to this. Are you, if a teenager comes to you and asks for oral contraceptives, will you give them? Will you? A majority would say no. Or are you going to wait till she gets pregnant and undergo the suffering? And so it is challenged now, the consent. What are you going to look at? Is it the quality of life of this kid and the kid to come if she has unprotected sex? So these are the challenges that you get. The whole the many ethical dilemmas, confusions will happen in years to come. It's bound to happen with the changing in the environment. So we'll have to be very careful. We'll have to be more cautious in approaches, and of course, working with the ethics committees. I think Professor Edirisinghe is here, and he would advise us what to do in this, because we, as I told you, at an average, we do as a private organization every year more than 100 research publications. And one of the things that we encounter is getting the ethical clearance. So why we do research? One thing is to get through the exams, maybe probably. Second thing, we have to put those data into the working, the practice, day-to-day practice. So we really have to look into this as a very positive mindset. If somebody is going to do a research, do something on a burning question. Last year, we changed the whole research concept. Now our organization is working on thematic research. We looked at the road traffic accident as a major issue, and then groups of students did a research on road traffic accident and found 65% of the patients are mishandled during the first hour of need. That's called a golden hour. So with that, we found the first responders in that research was the policemen, tuk-tuk drivers, three-wheel drivers, and the school children. Then another group did the assessment of their knowledge and skill of first aid and CPR. You know, out of these three groups, tuk-tuk drivers had the best knowledge. Now they have never gone through underground any training, but they go to the hospital every time with the patient. So these are the things that we really want to work on, and we all should get together and work on. Try to address a issue that is a day-to-day issue in the health system. Now we have already started a program to train tuk-tuk drivers, policemen, and the school children in our own way, in our area, to upgrade their skill and knowledge. Let's look at a major global challenge we all face. Like, look at Donald Trump. He's going to become a president. You can't stop him if he comes. He will do whatever he says, hopefully, right? So, like this, every day we have political influence. We are burdening political influence, especially the nursing administrators, health administrators. Do you think politicians are bad? You think politicians are bad? Politicians are not bad. They are good people. They are leaders. We have to make them more good by advising them, aligning them to what we want to do. So we have to be more competent than the politicians to advise them. So therefore, we have to push them towards goodness, do better things for our system. So with that thought, I will conclude my talk, and there'll be a 3 minutes video which I leave you with. Thank you very much.
There's no volume.
Hello, I am Mary Ellen Farr, and I have worked at Children's Hospital now for 32 years. I have seen a lot of changes in nursing in the last 32 years, and for the most part, they're very good changes, and I'm really proud to be part of that. Being in the recovery room, what I really enjoy is the fact that I can be a part of one of the most stressful days that. Hello, I am Mary Ellen Farr, and I have worked at Children's Hospital now for 32 years. I have seen a lot of changes in nursing in the last 32 years, and for the most part, they're very good changes, and I'm really proud to be part of that. Being in the recovery room, what I really enjoy is the fact that I can be a part of one of the most stressful days that they will ever see with their child. I can care for their child, I can care for them, and then I can teach them how to take care of their child when they leave and send them on their way in the hopes that I never have to see them again because they're good to go. I have children of my own. When they were little, I had the same fears about my kids as they have about theirs. And I don't know why I cry, but I want them to know that somebody else loves their kids too. No matter how stressful the job is, no matter how many times I have felt like I hated my job and feeling like it took everything out of me, it has all been worth it. Number one, a good night's sleep. Number two, take care of yourself. Eat well. Train yourself to eat well. Exercise when you can. Have another hobby outside of nursing that feeds you. Number four, and we talked about it up there, and I don't know how I developed this, but when I leave the hospital, I forget my patient's name, I forget what I did, and I not that I'm neglectful, but I turn that part off, and I go home, and I go and be with my family. Several years ago, when I worked in the cardiac ICU, we saw a lot of patients pass away after their surgeries. And we had one little girl who it was her second surgery in a series of 3, and she passed away that night. But what we did for the families, we would give them a box, a treasure box, a keepsake box, with like a lock of their hair. We would take an ink blot and we would make impressions of their hands and their feet. And I took the impressions of this little girl. She was like 15 months old, and I took an impression of her foot. And it's very difficult to get it perfect. And when I took the impression of the little girl's foot, it kind of smudged. So I took the card, it was cardstock, and I just put it in the trash. And I grabbed another one, and out of the corner of my eye, I saw the mother reach over and pick it up. Yeah. I just said, I'm so sorry. She says, I'll find a good use for that. And it broke my heart, you know, and it really showed to me that it wasn't just a job I was doing, it was an event in somebody else's life. And I will never forget that.